So I want to get into something that you really have gotten a lot of press for, which is this self-harm scar revision. How did you even come up with this to be a thing?
So it was purely by accident, actually. So there's an actress who I actually saw. She was on HBO. She's on Hawaii Five O and all that kind of stuff. And she's been kind of coming to me for years to do little things here and there and stuff, and just to kind of for camera work. Um, and she came to me, and we did our little, a couple of little filler here and there, and a little Botox. And then she said, "Hey, can you shut the door?" And I said, "Okay." And I sat down, and she was like, I want to ask you about something that I don't talk about to anybody. I said, okay. And so she pulls up her sleeve. She goes like this, and she shows me. And across her wrist is this indented scar with, I mean, it's clearly somebody, whoever put it together really wasn't, didn't care about it that much, because it's got like little puncture holes, and it's just a bad repair job. And it's indented, and it's red. And she's like, I this happened to me a long time. I did this to myself a long time ago. And now when I go to jobs, when I go to, to film, and or in my personal life as well, I have to cover it up, and I have to do a lot. And it's hard to do because it's indented. And I was thinking that we fill my nasolabial folds. Is it possible to fill this? Because this really impacts my life a lot.
Mm.
Um, and I said, I've never tried it before. I've never done this, but I don't see why not. And I think we should do it. So I did. So we did it. And then, I mean, it didn't, put a little bit of numbing cream, and it didn't hurt. It was easy to do. 5 minutes later, it's flat. Like that
Mm.
indentation, like it didn't exist. It's gone. I was impressed. I didn't know it was going to be that successful.
Mm.
She was in tears, and she was like, this changes my life.
Life
This is
changing.
incredible." And then so we talking about it, and then she said, "Do you have any idea in Hollywood how common self-harm scars are? How common it is that, girls and guys to some degree as well are cutting themselves and have all these scars that they're really ashamed of, and remind them of when they were depressed and when they were really in low. And they can't shake it, and it stays with them, and it pulls them backwards when all they want to do is go forwards.
Mm.
And so then from that, we formed Roll Up Your Sleeves. We tried to, and I said, it's so easy for me to do this, right? And there's different kinds of scars, and I do different things for different kinds of scars, but it's so easy to do this. You know, why not? And people think it's expensive, and so I'm like, okay, well, I don't care if that's fine. If they qualify financially, I'll do it for free.
Right.
So, you know, and I figured this profession has been pretty good to me, and has been pretty good to an awful lot of people I know. And so if there's a way to give back, and if there's a way that we can make people's lives so significantly better, so easily, how could we not?
Yeah. So explain the roll up your sleeves movement. What exactly is that?
So I mean, we should be in a society that doesn't stigmatize mental illness,
Mm.
right? I mean, we don't stigmatize diabetes. Like, we don't think they're a bad person for having diabetes. Why would we think they're a bad person for having mental illness, right? So we should be in that kind of society. We're not there yet. So in the meantime, there's a lot of people who are very self-conscious about these scars. And this is a movement to try to, first of all, normalize that people may have some scars, and it's not that big a deal. They've moved on, so you shouldn't judge them for something that happened a long time ago. But also to help people decrease their anxiety, decrease their kind of sensitivity about it, and which drags them back into depression. So to decrease the signs of that. So if they're raised scars, I can inject them with steroids and make them flat. If they're discolored scars, we can do laser and make them like, one color, the color of the surrounding skin. If they're indented scars, I can fill them. The problem comes if they're flat white scars. and we're still working on, on how to help with that. That's a hard thing to do.
So when I first read about this, that was the first time it had ever crossed my path, right? I mean, I'm not somebody who is familiar with anything like that, but it made me stop and really think about that concept that there are hundreds of thousands, if not millions of people, obviously, that at some point in their life were going through something. And the way that they took that out was to either try and kill themselves, or you hear all the time about people that just cut themselves in different
Yeah.
parts of their body to inflict pain. Um, and how prevalent that is. And it's secretive. Nobody talks about it, but so many people know about it because they've gone through it. And when you finally get yourself out of that behavior or those feelings, and you are able to move on, you're still left with those scars that give you that reminder. So it's not just in your head, it's physically there. It's a tangible thing. And so I want to just like talk about that for a second, because I don't think people get it if they're not, if that hasn't touched them personally, but how that can send you backwards and how terrible that is to constantly have a reminder on your skin, on yourself, like a tattoo of
Yeah.
something you don't want to remember.
No question, no question, and that's absolutely correct, and that's absolutely the right formulation of how these people are going through their lives. And if people think that they don't know someone who self harms, I got a surprise for you. Yes, you do, because the studies are saying among male adolescents, 7 to 14% self harm. Among female adolescents, 15 to 30% of all of them have self-harmed or self-harm. It is very, very widespread. It's something that's much more, people hide it, but the thing is that at one point they were depressed, anxious, feeling bad, feeling very badly about themselves, and did this behavior of self-harm. Years later, they may be through all that and they may be recovered, but they still have those scars. And those scars, every time they look at it, drag them back instead of letting them move forward with their lives and
Mm.
remind them of that time and remind them of how they felt like they were less than or different from everybody else who doesn't necessarily have those scars. And they make them think like, well, I'm defective. I had depression. Look at all these people walking around. They don't have it. I mean, they don't know it, but everybody else is going through, has their own shit that they deal with,
Yeah, right.
you know?
Um,
So,
yeah,
yeah.
go ahead.
No. So that's the thing. So that's just the thing. It's just, and it's something that really, I think, impacts people. Like I put out a YouTube video about it a few years back, and I was looking through the comments on it, and like one of the first comments on it was this woman who talks about how she's got these scars and they're raised, and she's really frustrated about them, and she wants to take a hot iron to them to make them flat. And it was wow, I mean, it's bad.
Right. So as part of the raise your sleeve movement about teaching other plastic surgeons or dermatologists, whoever, to do this kind of thing, I mean, is it well known in a doctor's office? If anyone could walk in and say, "Hey, can you fix this?" Would some doctors be like, I don't know how to do this."
No, it's not a big deal. It's fairly easy to do. I think that the problem is that not enough people, there's not really enough programs that will do this. I mean, people, I mean, it's a question of affording it,
Yeah.
first of all. And it's a question of people coming into their office and actually asking about it, because most people think that there's nothing you can do.
Right.
There is, and it's not necessarily very expensive. And with a program like this, where I've recruited a bunch of physicians who do this kind of thing, and they will treat people at they won't charge them, depending if if you qualify financially.
Mhm.
Um, I think it makes sense. I think people are just kind of it's a combination of just people not coming into physicians' offices asking about it
Right.
enough. You know?
It is interesting that mental health, I think, interjects plastic surgery more than people think. I mean, first of all, so many people come into the office because they're having so many issues with themselves and they want to just get an immediate fix. And then there's the opposite where they've now gotten to their point, themselves to a point where they are very healthy. And this is the last part of just like you're talking about cleaning up these scars, or they've been dealing with something for so long that would make them feel better, but it's not a mental issue. Can you talk about that, the difference a little bit?
So okay, so it's interesting. That's true. So there's there are really good studies, like quality research, looking at the effect of Botox in the glabellar area on depression. And what they're seeing is just that, like just a little bit of Botox right there has a similar effect as an antidepressant course, right? I mean, it's very, very effective. And there's now, Allergan, who makes Botox, they're like, whoo, that smells like money. And so they're pursuing it as an indication
Mhm.
because it works. So it's interesting because we minimize, we minimize aesthetic procedures as being kind of like foo-foo and, oh, isn't that's so vain and stuff like that. But it's human. Like it's built into who we are, and it's built into our kind of reproductive desire. And so the
Yeah.
desire for appearance, it's not going anywhere. And so the patients that come in, and this is the thing in my field, is that you have being able to tell which patients are good candidates for the procedures that we do and which patients really have body dysmorphic disorder. It's really
Mhm.
is critical. But I think there's a good amount of people who legitimately you do this little thing and it really increases their self-esteem and their belief in themselves. And that's fine. That's not that's okay. And and the thing about one other thing that I wanted to mention is, so I'm in a project now with self-harm scars that's not just about depression and anxiety. One of the other things that we need to talk about when we talk about this is also substance abuse, right?
Mm.
So there's a place in Santa Monica called Malone Collective, and it's an area where they do therapy, they do all different kinds of therapy. They do Reiki, they do massage, they do talk therapy. They do we exercise, whatever it is that you need. So it's kind of like one of those. It's an outpatient form of one of those inpatient Malibu facilities, right?
Uh-huh.
And so we think that self harm scars and also aesthetic treatments should be part of that conversation. Because you imagine, right? You're recovering from addiction, and again, you are you've recovered. You are now beyond out of that world and into, to some degree, a new world, and a new future.
Mhm.
But yet you have these scars that are pulling you backwards.
Mhm.
And I think that's really it's important. So I think it's an important part of that that transition into the next stage of your life is
Yeah.
to decrease those signs when you look in the mirror or when you look at yourself. You decrease those signs of your previous life.
Right.